very warm welcome to you all to this special edition of One-on-One, where we will talk about Exercise Referral program launched by the Malicious Sports Council in collaboration with the Ministry of Health and Wellness a month ago. The Exercise Referral program is where a patient is recommended to practice some exercises in order to improve his or her health. During this episode, our guest Dr. Adisha Bholah, Program Officer of the Exercise Referral Program, and Emily Newton, Senior Lecturer in Physical Activity, Sport and Health from the UK, will give us more insight about the concept of exercise referral and its benefits in empowering people to adopt a healthy lifestyle. Dr. Adisha and Emily, thank you for joining us in the studio of the NBC.
Thank you for having us. It's lovely to be here.
Emily, exercise referral is the use of physical activity to improve someone's health, well-being and overall quality of life. You have actually worked in that field of exercise referral, conducted numerous training. Explain to us the concept of exercise referral and who is it exactly targeted for?
So, yes, I've worked in the field and I understand how hard it can be for some people to try and increase their physical activity levels, even though we all know deep down that moving more and doing exercise is really good for our health. So exercise referral schemes are there to help people that are suffering from long-term health conditions or are at risk of developing a health condition to help improve their activity levels and use that as a treatment. So they are targeted at people that live quite sedentary lifestyles or people that don't take part in any regular exercise or any physical activity.
Can it be seen therefore as a substitute to medical prescription?
It's something that can work well alongside medical prescription. There are some medications, for example, heart conditions or diabetes that maybe do need a medical prescription, but physical activity can be used as an adjacent treatment to help manage the condition and also reduce the risk of further illness, which is really important.
Yes. Emily, but what is exactly the difference between exercise referral or personal training?
Good question. So exercise referral is all about empowering the patient to try and increase their activity levels. So we are spending quite a bit of time helping to educate them and helping to support them to become more active. Whereas personal training is about working with somebody one-on-one for an extended period of time. So personal training is a private setup, an agreement that you would have with an exercise specialist, and they would work with you over to help reach a goal or for a longer time, whereas in exercise referral, we're helping to support the patients to develop the skills and knowledge they need to increase their activity levels independently. So you might be on an exercise referral scheme for a set amount of time, but the end goal would be for you to continue increasing your activity levels afterwards.
Dr. Adisha, can we therefore say that exercise referral scheme is therefore aimed for people who have certain health risk and that could be alleviated or improved through physical activity?
Yes, like you rightly said, Koyal, exercise referral is specifically for patients, so people suffering from non-communicable disease or any kind of disease. Unlike like personal training is for like a client or somebody who might be healthy. Exercise referral has shown a lot of positive benefits for the patient. We've seen like cut off on medications, adapting a healthy lifestyle in itself, and a lot more positive benefits like that. Yeah.
And in fact, the Exercise Referral Program was launched by the MSc a month ago. And do you believe that by integrating the scheme in the medical sector will encourage people to adopt a healthy lifestyle and practice more physical activity?
Yes, indeed. We actually strongly believe in exercise referral program, and not only me, a lot of people at the MSc actually strongly believe in that project. So what we know from the literature is that exercise referral actually work. But what we do not know is will it work in a Mauritian setting. So what we tried to do is to set up a pilot program for 24 weeks, like you might be aware. So it's set up in Helvetia Mediclinic and in l'Escalier Mediclinic. And so we're doing an evaluation after this 24 weeks to see if it has actually worked or not, and further, adapt, if need be, the program for specific Mauritian setting.
So it is pilot-based for the moment?
Yes, it is on a pilot basis.
And what is the duration exactly of the program?
So the pilot program is of 24 weeks duration, but one patient is going to stand for around 20 weeks in the program. Yeah.
Does that include children as well, or you have only adult and older ones?
So for this pilot project, the inclusion criteria is 18 to 65. Yeah, so we're not taking children now. Maybe like on future phases, yes, but not for now.
Emily, during your visit to Mauritius, you have actually also held a capacity building workshop whereby some 15 new exercise referral consultants have been trained. Share with us the purpose of that training and how was that experience for you? How were the training conducted?
Yes, we actually finished the training this week and it's been fantastic. The level of the students has been incredible. They have really worked hard and they seem to have really enjoyed the training and taken a lot from it. So the main focus of the training is to basically ensure that they understand the main reasons why people, in particular people with non-communicable diseases, aren't taking part in much physical activity or much structured exercise. Once we understand maybe why people aren't doing the exercise, we can work with them to try and develop strategies that are going to be client-centred to help them increase their activity levels. So I've done a lot of support surrounding behaviour change and also motivational interviewing as well. Once we've been through that phase of the training, we've then looked at some of the key medical conditions. So what it's like to live with metabolic disease, to live with a heart condition, and how we can then structure exercise that's going to help to improve people's quality of life, help to maybe manage their condition and reduce risk of further non-communicable disease.
So it's important to train the consultant so as to have effective results then?
Yes, it is really important. And because I'm from the UK, we've had exercise referral in the UK for nearly 30 years. So based on all of the research and all of the schemes that have run there, we're able to take the best practice, evidence-based practice, and then provide it in the training here. So everything that the students are being taught, is really current and really evidence-based, which is very important when we're building in a new scheme.
And how do you see the level of the consultant here?
Oh, the consultants are amazing. So the consultants are already either working as medical professionals or health professionals, I should say, or as exercise professionals. So they are already coaching or instructing exercise or working with people with health conditions in some form. So their base level of knowledge is excellent. So it means that the training I provide is bringing them up to help work with people that are deconditioned, that are sedentary, that have non-communicable disease or are at high risk of developing non-communicable disease. So yeah, the training's gone really well. I've been really happy with it.
Adisha, you are actually the program officer of the Exercise Referral program. Share with us the feedback that you've got from the consultant regarding the training.
They absolutely loved it. It was 3 amazing days of training whereby we started off with a group of people who actually did not know each other, and by the end of the training they were literally sharing information, and just like Emily said, so we have actually a lot of knowledge in that group of people, and sharing that knowledge was even more helpful to the capacity building that we held. So I am very happy about it, yeah.
Mm-hmm. And Emily, like we said, the overall aim of the Exercise Referral program is to encourage people to have a more active lifestyle in the future. But what are the different exercises that a person should do? Because there's no single type of exercise that can actually fulfill all of our needs.
Yes, that's very true. So the main types of exercise that I'm teaching about would be cardiovascular, resistance training, but then also balance and flexibility work. Now, the way our programs work is that they are completely client-centered. So it's really important the exercise referral consultants understand what the needs are of the client, what the client actually wants and what we need to do in terms of exercise to help protect them from risk of further non-communicable disease. So exercise is very important, but we take the prescription and make it really centered to what that client actually needs.
Exactly, what is the process actually to recommend a person for exercise? Do we actually have a specific process for that?
Yes, probably Adisha can discuss that more, and I can add in any detail.
Yeah, so for the time being, in the Mauritian context, I'll walk you through how the process goes in the pilot project. So the recruitment is being done by the doctors at the area health center or at the mediclinics, whereby they have, some selection criteria. They actually give permission to the patients to practice exercise, and they are being referred to the exercise referral consultant, who is just sitting next door, and they walk to the exercise referral consultant with their referral note and their diagnosis and what medication they are on, and then the exercise referral consultants see them for their first interview, first meeting. This is a very structured first meeting, first interview, which might take around 45 minutes. They do, they start by introducing themselves, introduce exercise to them, and, do behavior change and motivation change procedures with them, and they give off a final structured, tailor-made exercise plan to that person, and then follow them up. They will again, follow that patient up maybe in 4 or 6 weeks, depending, on the motivation level of that patient, and then help them throughout, their change in lifestyle. We also propose these patients to go to the current MSc programs that are set up right now, so walking clubs, and even exercise for health clubs. Some are even referred to swimming classes. So it's a variety of exercise that we're proposing to our patients.
Yes. Mm-hmm. And Emily, you've mentioned that it's important to have a mix of exercises, that in a way the person also will be active and the routine will become fun. But what does a balanced exercise consist of?
Great question again. Well, it really depends on what the person needs to do to basically improve their functional capacity, improve their independence, improve their quality of life, reduce their risk of developing more disease. So I like to program in quite a balanced way. So I like to have a combination of cardiovascular exercise, resistance training as well. But the most important thing for me is finding things that the person wants to do. So maybe reigniting a passion with an activity they previously did when they were younger, or trying out a new sport or a new exercise class, or even exercising at home if they're short of time. There's always something that we can find for somebody to do.
Mm-hmm. And Adisha, the exercise referral program is being considered to be recommended to cancer patients as well. But is it safe for cancer patients to do exercise?
I would say yes, it is actually safe for cancer patients to do exercise. It is not only safe, it is actually very beneficial for a cancer patient to be physically active and to practice some sort of exercise. We've seen, Emily, who is a specialist about cancer in here, she can walk you through the different stages of
Does
when
it depend
exercise.
on the type of cancer that they are suffering from?
That does need to be taken into account when we're exercising, and there definitely are things that maybe shouldn't be done with certain cancers, depending on the nature of the cancer, the stage, and also depending on how it's impacted that person, and how fit and how able they are to do some additional exercise. But we know that exercise can be a useful tool at any stage in somebody's cancer journey. So prehabilitation exercise before they start treatment. We can exercise people during treatment. There's the rehabilitation after treatment's ended. And then unfortunately, if somebody needs palliative care, then we can also provide some physical activity opportunity there as well. And whilst that's not going to change their diagnosis, it's going to improve their quality of life. It might provide distraction. It might be something that's enjoyable for them and something that actually makes them feel a little bit better within themselves.
So, do you believe that physical activity may help the cancer patient to cope with the side effect of their treatment?
Yes, definitely. I believe it, and I've also seen it, and I do work with people that are going through cancer treatments. So when somebody is going through cancer treatment, they are extremely exhausted, poorly and fatigued. So they do spend more time resting, recovering, and in bed. So their fitness levels can reduce. Also, their lean muscle tissue that can reduce as well. So physical activity is important to try and maintain as much fitness as we can and maintain as much muscle as we can, because the more of that we have, the stronger our body is, and the more we can cope with those treatments.
Then, how can regular exercise help the patient after treatment?
After treatment, it can help us to recover. So we call out the rehabilitation period. So while somebody is going through that, they're helping to restore their body, to increase their fitness levels again, increase their strength, their functional capacity, so they can be more active in their daily life, and hopefully, return to work, because we know that when somebody's going through cancer, it's a really difficult time financially, and it can disrupt everything that you would normally do.
Adisha, but can we say that how much a person should exercise? It varies, like it should depend on the disease or illness they're suffering from.
So what I would recommend is that at least do some, physical activity and some exercise. If you can't do, you've got the WHO recommendations that we guide ourselves to, the 150 minutes of moderate intensity aerobic exercise plus 2 strength training plus flexibility and coordination. But these are only, guidelines. It is important that, we target to these guidelines, but at least do some kind of physical activity is more
The
than
goal is to be
helpful.
active then, because
Yeah.
then it would help the person to function in a much better way, right?
Yeah, I agree.
Yes. Emily, do you think that it's more challenging now to help people to be physically active, especially with the world changing and technology evolving?
Definitely, and this is a global issue. Our activity levels have decreased over the last couple of decades, and that's because of all the labour saving devices and the advances in technology that we have. People now, lots of people have access to public transport, to cars. We don't have as much manual labour and physical jobs, so people are just not moving as much as they used to.
And Adisha, how do you view that trend in Mauritius? Do you believe that it's easy to encourage the patient to do the physical fitness and be able to supervise them that they are doing that properly as well?
It depends actually, on patients, but I wouldn't say it's not happening. It is actually. We can see the change happening from sedentary people who are not used to doing exercise being more physically active, or people who have never exercised before doing our exercise for health workouts. So the changes here, I'm very hopeful, I'm very positive, and we're working towards it.
I think we should just get started.
Yeah.
Like walking as well is a form of exercise, right? That should also be encouraged.
Yes, indeed. And at the Mauritius Sports Council, we do have walking clubs, and this is where we actually show people how to do like proper warm up and walk as to moderate intensity, and we also teach them the amount of walking they actually need to do, and they also get together. People get together, and it is a social kind of an event, and people are quite enjoyable of our walking clubs.
And Emily, you've mentioned about cardiovascular fitness earlier. Tell us more about it and how it may help to improve blood pressure or even blood flow.
So cardiovascular fitness is really important. We know that the fitter someone is, the more likely they are to live for longer, but also their quality of life, their functional capacity can improve in line with their level of cardiovascular fitness. So it's something that we really do want to recommend, and one of those key World Health Organization guidelines. So the cardiovascular fitness can be improved by doing anything that's maybe going to get you slightly out of breath. So we tend to spend a lot of our time in either sedentary, sat down, or doing light activity, so just stood up or walking around slowly. We actually need to maybe try and walk a little bit faster and challenge ourselves so that when we are walking, maybe we can still talk, but we can't sing. That would be an indication that we are in a moderate intensity activity, and that's going to be a little bit more beneficial for our health.
So what are the different types of cardiovascular fitness that exist?
So in terms of intensity is probably the way I can explain that best. So we can do light intensity activity, which is where we just stood moving around. We can do moderate intensity activity, which is where we are raising our heart rate, our temperature, maybe starting to sweat a little bit, or starting to struggle to hold a long conversation. And then we've got vigorous intensity, which is really much harder work, and we would be really struggling to hold a conversation there. We might be struggling, getting a little bit short of breath.
And let's talk about the older people now. What are the type of exercises that are recommended for them? Maybe Adisha, you can tell us about it.
So for older people, it is important for them to get moving in general, get them out. We would also, on top of the normal WHO guidelines, the 150 minutes of moderate intensity aerobic activity, concentrate on strength training. It is quite not well seen when we ask like older people to do strength kind of work, but the evidence actually shows that strength workout is actually what older people need. They tend to have a loss in muscle mass, and it is important to at least maintain that muscle mass. If not, we can increase. What we also recommend is working with their balance and their proprioception. This is important because older people tend to have fear of fall, and these kind of workouts actually work against fear of fall and the risks of fall and your risks of fractures also, which comes afterwards.
So, being physically active, meeting those physical activity guidelines, if you're an older adult, reduces your risk of falling by 68%. So 68% reduction in chance of breaking your hip, which is a life-changing injury. So it really is important that we get our older adults moving more frequently, but also doing strengthening exercises and balance exercises too.
What is exactly strength training exercises, and how can it help to improve the balance?
So strengthening exercises are any kind of exercise when you are lifting up a load or you're basically challenging your muscles. So any exercise where you're even using your body weight or using any kind of household items, a water bottle or a can, just to challenge would be a strengthening exercise. So you don't actually have to have access to a leisure centre or a gymnasium to do this kind of work.
Flexibility exercises like yoga and stretching may also help to reverse the shortening and tightening of muscles.
Yes, they can. So flexibility and yoga, all of these exercises can be really useful because when we are sat down for long periods of time, our muscles get tight. We get tight in our shoulders, chest, tight in our hips. So it is important that we stand up more. And if we can do any kind of structured exercise, it's going to encourage increased flexibility. That's really positive.
And how far do you believe that exercise referral can be used to alleviate some mental health problems like anxiety, depression, even stress? Say?
I think exercise referral can be used to help all three of those. Even if they aren't diagnosed conditions, we all struggle sometimes feeling a little bit low or maybe get anxious or stressed. And we know that moving more, doing more physical activity can help us all to develop coping mechanisms and improve kind of our mental health essentially.
And Adisha, are patients actually in Mauritius being recommended now who are suffering from mental health issues being recommended to exercise referral program yet?
Not yet, but it is in our future goals, yes, to expand to people suffering from mental health disorders.
The program has actually been launched a month ago. How effective do you see it until now?
So we do not have official statistics right now, and but from what the feedback we're having from the patients, from the exercise referral consultants, and especially from the doctors, from the Ministry of Health, we see that we're having a very positive impact of the pilot project on the population. And I extend my vote of thanks to all of the people who are actually helping to make this program happen.
And Emily, what's your view on the effectiveness of exercise referral in general? I mean, you've been part of the program in UK, now even in Mauritius, so tell us about it.
Exercise referral can help to reduce blood pressure, it can help to reduce body mass index, it can help to improve our fitness levels and increase the amount of physical activity that someone's doing. So it can be something really, really positive for somebody to take part in, but it's not easy to increase your physical activity levels. It's not easy to exercise more, especially if you're used to living quite a sedentary lifestyle, or maybe you don't see yourself as being a sporty person. So, we need to take behaviour change strategies to help people to improve and help to take part in more exercise. So yes, it can be successful, but we need the right people working on the schemes, and we need to apply some of these behaviour change techniques as well and ensure that client-centred, appropriate exercise programs are created.
Definitely. We are actually drawing toward the end of this episode, but before that, Emily, any advice you would like to give to our audience to encourage them to adopt a healthy lifestyle, practice more exercises in order to be healthy mentally and physically?
So we're at a really positive point at the moment where we now have guidelines for exercise prescription for lots of the main medical conditions that people are suffering with. So you can go and see a specialist and get exercise prescribed, but in the meantime, just try to move more, try to stand up a little bit more often, and try to find something that you really enjoy doing, something that truly brings you joy. Because we don't want exercise to be a chore, we want it to be something that you look forward to and you get pleasure from. So whether that's dancing or playing badminton or doing something social with your friends, going out for walks in the evening, it's nice to just try and find something that you enjoy doing that makes you feel good.
And Dr. Adisha, your words of wisdom to our audience, especially our youngsters, when it comes to physical fitness.
So I would encourage the youngsters to participate fully in their physical education, their PE classes. You have a very important opportunity to explore all kinds of sports during PE. So go for it, enjoy sports, and be more physically active.
Thank you, Emily. Thank you, Dr. Adisha, for being with us tonight and give us so much details about the program and why it's important to practice physical fitness.
Thank you, Koya.
Thank you, lovely to meet you.
Dear viewers, we have now come to the end of this episode. Thank you for your time. We hope to catch you next week at the same time, same channel. Have a great evening.